First of all, far be it from me to disagree with a Harvard professor, but there was a study yesterday in the New York Times that showed that Medicare expenses were about $1,300 more expensive if people came into the system who had not previously had insurance. So we're going to let that
probably done by my colleagues, actually.
So we'll see how that gets explained into all this. Secondly, what the Congress is doing is not reform. The question is, will they allow us to reform the system? Will they allow us to have choices that allow us to reform the system? In the House, the Senate Finance version, the answer is no. You're not going to get to reform the system. We're going to keep the system we have. In the House versions and the Dodd version, the answer is yes, there will be alternatives. Let me tell you how insurance works. In a capitalist system, which we enjoy in this country, you measure the productivity and the success of most companies by how much profit they make and what their return on equity is. In the health insurance business, that's actually a measure of inefficiency, because every dime of profit and return on equity is a dime of your premium dollars that is not going to health care. So the real choice that we have to be able to make is we have to be able to choose between a public option and a private option. Most people will choose a private option. They're more comfortable with that. But if you don't have the public option run by the government, not run by insurance companies or what I call the fake public option, the triggers and the co-ops and the God knows what, the Cantwell Amendment, which is very well intended, but we all have those, many of us have those plans in our state, a real public option. If you don't have that public option, you do not allow the American people to have a choice of a system which is guaranteed issue, community rated, can't be taken away for loss of job or any other reason, and total portability. That's what the public option grants you. I think that's an easier way to get insurance companies to move towards that way than it is to have and impose regulations. The regulations for guaranteed issue and all that stuff are just delightful in the Senate. They really, in the House, even in the House, which is a stronger bill, we did all this stuff. That's how I know so much about this, besides being a physician. We did all this stuff in Vermont 15 years ago. I don't want to get too technical, but the rate band for guaranteed issue is 20% in my state. That means you can't be turned down for any reason but non-payment of premium. And the most you can charge the sickest patient actuarially in your insurance company is 20% more than the cheapest. The smallest rate band that I've seen here is 100%, and some of them are 300%. That's not guaranteed issue. That's not insurance reform, because if you can be charged 3 times as much as another patient in the same insurance company, you're not going to be able to afford the insurance. This is not healthcare reform, what's being discussed in the Senate. And we're not asking them to reform healthcare. All we're asking is to give the American people the opportunity to have real choice. That is not present in the Baucus bill. It is present in the other 4 bills. We're very hopeful that a real public option will emerge from this, not because we're going to end up in a single payer, not because we're going to put the insurance companies out of business. That's not going to happen, but because allowing American people to make real choices is the only way to reform the system.